There have been a lot of reported advantages of telehealth. But I also know, and there's been a lot of coverage about that there are downsides of telehealth as well. What do you see as the downsides?
Well, first, a little bit of a downside is you still want to have that one-on-one interaction with another human being every once in a while, especially with the therapist. Just because my therapist mentions it's easier for them to see body language and little thing aspects like that, but it's so important to have the telehealth that's not as big of a deal. But the downsides, the main one, are the fact that so many people don't have access to it. You take for granted when you're able to just hop on your computer, hop on your high-speed internet, click on to speak with your doctor, that there are so many others in this country that can't have that opportunity. I mean, we still have 40 million people, households in America that don't have high-speed internet. You combine that with the cost of these devices. It makes it, some people aren't even that very comfortable navigating them in the first place. So that's the real downside, is that it works so well for me, but I also know that so many don't have access to this. And when everything was shut down during the pandemic, they didn't have many options. Some of the facilities were closed completely at times, except for emergencies. And then the fear factor alone of going in to see a physician or anything like that during the pandemic, it's just something that was really, like I said, it's something I took for granted, and so did some of my other friends or people I know that were able to do it. And also the downside for me is I know that affected the African American community and other communities of color more than anything else, because those are the people that are less likely to have have access to high-speed internet and all these devices to be able to get on to enjoy it. And it's another reminder of how certain things, some aspects are built in for our infrastructure. That's pretty much like systematic racism almost, because if those people don't have it, just once again is showing another way where they're disadvantaged in those neighborhoods from being able to get something that's so important as healthcare. And that's part of this whole push for the healthcare equity. This is a huge part of that. And we're definitely going to have to do something with the funding for the infrastructure and things like that to get that taken care of.